Hi everyone, my name is Nicole Drucker and I'm a registered dietitian student at the University of New England. I'm here today to talk to you about my IRB proposal on vitamin D supplementation. Does vitamin D supplementation significantly decrease the BMI among night shift female nurses who suffer from obesity with a BMI between 30 and 40 with hypovitaminosis D? Vitamin D is a fat-soluble vitamin that is essential in maintaining homeostasis in the body on a molecular level that aids in the metabolism of calcium, magnesium, and phosphate for bone growth. In order to maintain a healthy level of vitamin D, it is recommended to have 30 nanograms per milliliter of 25-hydroxy vitamin D. The inability to maintain this level of vitamin D through sun exposure, nutrition, or supplementation could lead to metabolic conditions such as obesity. The hypothesis of this study: vitamin D supplementation will improve the BMI among night shift female nurses who suffer from obesity with a BMI between 30 and 40 who have hypovitaminosis D. The purpose: vitamin D deficiency has become a major health concern globally. The purpose of studying this deficiency is to research the effects of vitamin D supplementation on individuals who are deprived of sun exposure due to their geographical location as well as their occupation. Through this research, I hope to help those who have hypovitaminosis D decrease their BMI or spark other researchers to look into hypovitaminosis D in the future. Vitamin D metabolism. Vitamin D is unique to other vitamins because it can be produced through the skin endogenously when exposed to sunlight and could be consumed through supplementation in foods that contain vitamin D or are fortified with it. On a cellular and molecular level, vitamin D must bind to the vitamin D receptor. Through these actions, the vitamin D helps to regulate the range of genes expressions that take part in cellular proliferation, differentiation, DNA repair, apoptosis, and angiogenesis. The leading function of vitamin D in the body is to maintain and regulate calcium homeostasis and essentially assisting bone mineralization. Vitamin D receptors have been found in multiple tissues, organs, and organ systems, as well as have immune-modifying effects and is associated with glucose homeostasis. Hypovitaminosis. The main cause of hypovitaminosis D is insufficient amount of sun exposure. An impaired ability to absorb and use vitamin D in the body, along with inadequate diet and increased excretion, could result in the decline in vitamin D concentrations in the blood. Depending on the severity of the deficiency, supplementation would be adjusted. For someone who is deficient in vitamin D, it would be recommended to supplement with 6,000 international units or 50,000 international units weekly of vitamin D3 until serum 25-hydroxy D level exceeds 30 nanograms per milliliter. After the 25-hydroxy D levels exceeds 30 nanograms per milliliter, it would be recommended that 1,000 to 2,000 international units daily for maintenance. However, for obese individuals, a higher dose of vitamin D supplementation would be recommended for 10,000 international units a day. According to the Institute of Medicine, a vitamin D deficiency would be less than or equal to 12 nanograms per milliliter. Based on a meta-analysis, when participants who were obese consumed 20,000 to 30,000 international units of vitamin D weekly, they had a higher vitamin D serum levels. When obese participants consumed vitamin D, their bodies were able to retain 38.17 nanomoles of vitamin D, meaning that their bodies had lower vitamin D levels than their non-obese counterparts. It's important for the obese population that is deficient in vitamin D to consume the appropriate amount of vitamin D that will be beneficial for their weight and age. Obesity. Vitamin D is a fat-soluble vitamin. Therefore, when there's an increase in BMI, there's a decline in vitamin D in adipose tissue. In other words, there's a dilution of the vitamin D following the increased adipose tissue, serum, liver, and muscle that is present in obese people. Hypovitaminosis D has been correlated to visceral adiposity, and in turn could be a biomarker that's related to visceral adiposity-related dysmetabolic states that include cardiovascular disease, type 2 diabetes, dyslipidemia, and atrial hypertension. For those who suffer from these disease states, it seems as though weight loss is the best way to help improve vitamin D concentrations. The adipocyte hormone leptin aids in the decreasing food intake as well as body weight. The resistance to leptin on a cellular level has been correlated to obesity. Systematic inflammation in the body can be caused by adipose tissue secreting adipokines and fatty acids that can eventually result in insulin resistance and increase in triglyceride levels. Dietary intake. When it comes to dietary intake, the recommended dietary allowance that people ages 1 to 70 consume is 600 international units a day. For those over the age of 70, the recommended daily amount was 800 international units a day. Determining the amount of vitamin D needed for the body is difficult because vitamin D is absorbed through the skin and through the digestive system. Measuring vitamin D through the blood serum levels is the most accurate way to determine if a person is vitamin D deficient. Therefore, it's important for those who are high risk to get tested for vitamin D deficiency. Weight loss. Since hypovitaminosis is correlated with a higher risk of health conditions like obesity, supplementation of this vitamin could aid in weight loss. Therefore, there are various risks when it comes to night shift work among healthcare workers that include weight gain, overweight, obesity, and other metabolic pathologies. When compared to healthcare workers who work the day shift, night shift workers are at greater risk for developing hypovitaminosis D as well as obesity. Based on a meta-analysis, there is a direct correlation with higher waist circumference and deficiency in vitamin D. Vitamin D is essential for bone health, and without a sufficient amount, many organs and organ tissues are in jeopardy. Based on a 6-week double-blind study conducted among females between the ages of 20 and 40 who are obese and overweight with vitamin D supplementation, their BMI, waist circumference, and weight improved. According to a meta-analysis, the parathyroid hormone stimulates fat growth in adipose tissue, then influx in intracellular calcium through cholesterol. Cholesterol has been shown to assist in calcium absorption, which aids in weight loss. Weight loss is based on multiple factors, and one can be maintaining adequate levels of vitamin D. Research methods. The population for this study would include 274 female nurses aged 25 to 50 who reside and work the night shift in hospitals located in Massachusetts. The number of participants was based on a priority t-test using a G-Power software. The subjects must have a 25-hydroxyvitamin D level less than 5 nanograms per milliliter, which is considered a severe deficiency, and have vitamin D between 30 and 40. Participants with issues metabolizing vitamin D will be excluded from this study. The scale used in this study will be 150, 10, 5 digital physician scale, eye level that has integrated height rod measurements. The scale has the ability to calculate BMI. For hydrostatic weighing, the Exertex standard weighing tank will be used to determine lean body mass and fat percentage. The device used for UV exposure tracking will be QSUN. The study will begin March 1st, 2023 and end June 14th, 2023. The rationale for this time period is that the sun exposure in the spring months and the fall months would be similar and would account for half the year. Conducting the study during the winter or summer months would be an opposite end of the spectrum. Starting the study in the spring could be beneficial to track where the participants are at coming out of the winter months, where it can be difficult to get the adequate amount of sun exposure and even more difficult to obtain when working the night shift. Once there are enough participants interested, the participants will be given a waiver before they can begin screening and eventually interventions. Out of the total 274 participants, 137 participants will be the control group, and 137 participants will be in the study group. Each participant will be given a wearable sun tracker. These participants must wear a sun tracker called QSUN whenever they are outside during the daylight hours and download the app to get an accurate measurement of how much sun exposure they are actually receiving. Once the participants have passed the screening, the 16-week study can begin. The control group will be giving the placebo pills, and the research group will be giving daily supplementation of 6,000 international units of vitamin D. After 8 weeks, both groups will have their blood work taken to obtain the vitamin D levels, sun exposure, body composition, the hydrostatic weighting, and data for BMI will be documented by a medical professional. For the next 8 weeks, the research group will be given a lower dose of vitamin D at 2,000 international units, and the control group will continue with the placebo pills. After the additional 8 weeks, the vitamin D levels in the participants' blood will be collected, their sun exposure, their BMI, and body composition through hydrostatic weighing will be documented by a medical professional. When the medical professionals are performing the tests and collecting data, the participants will be notified of their status. If the results take longer to come back, the participants will be given a phone call. Confidentiality. The confidentiality of the data will be maintained in a medical database called ClinicWorks, besides the initial survey. Since the survey asks for personal data, the participants will be informed of the intention for the data. Only the research staff and medical professionals taking part in this study will have access to the data, including the statistician. Throughout the study, it is important to have the participants' identifiable information in order to track their progress throughout the study. The identifiable data can be destroyed by deleting the survey results and erase the data from the hard drive. Research setting. The research setting will occur in a research laboratory located in Cambridge, Mass. to collect the data for BMI, sun exposure, body composition through hydrostatic weighing, and blood tests conducted by a medical professional. Consent. When arriving at the follow-up appointments, the participants will be given consent forms to sign before tests are run on these subjects that will be collected by an investigator as a representative for the subject. For this study, there'll be a research investigator, a study coordinator, a research pharmacist, 20 phlebotomists, 20 research nurses, 20 study physicians, and a statistician. The setting will be compared to a doctor's office where you can check into a waiting room and call back for testing, and the appointment time should not exceed 1 hour. The participants will come back and have a BMI calculated with the 150-10-5 digital physician scale eye level and the UV data recorded from the Q-Sun device recorded by a research nurse, have their blood drawn from a phlebotomist in their own medical examination room, and have their hydrostatic weight done. Before leaving, the participants will see the research pharmacist and given their vitamin D supplementation or placebo. The risks of this study include consuming too much vitamin D through supplementation. When consuming vitamin D supplementation over an extended period of time, participants are at risk for hypercalcemia or a buildup of calcium in the body that can damage both the kidneys and the heart. Vitamin D toxicity can also cause nausea, vomiting, poor appetite, weight loss, constipation, weakness, disorientation, and confusion. Vitamin D supplementation is safe with appropriate dosages. Without an insufficient amount of vitamin D in the body cannot absorb calcium, which can be detrimental to bone health and cause other complications when it comes to muscle function, immune health, and brain cell activity. The supplementation given in the study is recommended for those with severe vitamin deficiency. Prior to this study, the research team will be attending HIPAA training. Vitamin D supplementation for those who have hypovitaminosis, the rewards outweigh the risks. Vitamin D deficiency can cause detrimental health outcomes, and risk of acquiring vitamin D toxicity is marginal. Vitamin D deficiency affects almost 42% of Americans and nearly 1 billion people across the globe. Therefore, this study could help benefit night shift workers and those who are severely deficient in vitamin D, as well as to help prevent this deficiency in the future. Data analysis. The results of this study will be analyzed quantitatively through bar graphs comparing the control group with the research group based on the duration of the study through Microsoft Power BI. The data will compare the results in the participants in the control group to see if their 25-hydroxyvitamin D levels improved through the proposed intervention. The data collected for BMI and hydrostatic weight will be compared at the same bar graph and compare the control group and the research group. When it comes to tracking sun exposure for these participants, it will be based off the percentage of sun exposure based on each 8-week time period through the phone application. For the UV light radiation data, the control group will also be compared to the research group to ensure that there are no discrepancies in the 25-hydroxy vitamin D levels in the lab work. The data will be conveyed through visual aids such as a bar graph comparing the BMI, hydrostatic weight, 25-hydroxy vitamin D levels, and sun exposure of both the control group and the research group. There will be 3 of these bar graphs showing the 3 different data markers, the first being the initial, the second being the 8th-week follow-up visit, and the end of the 16-week discussion. The knowledge gained through this study will be able to impact the lives of those who suffer from vitamin D deficiency and obesity. These are both common medical issues among the United States population. Therefore, it would be beneficial to have some clarification on whether vitamin D supplementation positively impacts weight loss and overall health. This could potentially change the lives of many and help prevent vitamin D deficiency through research data. After researching recent literature, it is evident that there are gaps in the data when it comes to this critical health concern. Conclusion. The limitations for this study include the reliance of the participants confining with the appointment times, wearing the UV tracker, and the research group taking vitamin D supplementation daily. This study could involve human error, and it is important to take into consideration when viewing the results from the collected data. However, the biometrics data collected for this study will be concrete because it will imitate routine procedures in medical laboratories. Since the participants know that their BMI is going to be analyzed and their weight will be measured, they could subconsciously make different lifestyle choices. This is otherwise known as the Hawthorne effect. When people change their lifestyle behaviors because they're aware that they are being watched or tracked. In the future, this study could help stress the importance of vitamin D deficiency screening and could become more of a routine part of medical examinations. This screening could be most beneficial for those who are at higher risk of deficiency due to their lifestyle. This study could also help spread awareness of the severity of vitamin D deficiency so that it is taken into consideration for medical professionals when treating the whole person. Taking vitamin D supplementation could become a routine part of weight loss regimen if recommended. Overall, the findings of this study will give medical professionals and researchers a better idea of the impact of vitamin D has on weight loss among those who are deficient and suffer from obesity. Thank you for your time.